If you're over 75 and you think walking is the best exercise you can do for your health, I need you to pause for just a moment, because what I'm about to share with you might be the difference between maintaining your leg strength and mobility even at 90 or ending up in a wheelchair at 70. Now, don't get me wrong, walking is wonderful. It's good for your heart, it's good for your mood, and yes, it absolutely has its place in a healthy life. But here's what most people don't know, and what many doctors are now starting to talk about more openly. A major study published in the Journal of the American Geriatric Society followed over 2,000 adults aged 75 and older for 3 full years, and what they found was eye-opening. The seniors who did specific leg-strengthening exercises just twice a week were 43% less likely to suffer a serious fall compared to those who only walked for exercise. 43%. Let that sink in for a moment. Now, here's the part that really matters. Falls are the leading cause of injury-related death in people over 75. Every year, more than 3 million older adults are treated in emergency rooms for fall injuries. And the sad truth is that many people never fully recover their independence after a bad fall. But it doesn't have to be this way. The real secret to staying independent, mobile, and confident as you age isn't just about moving your body. It's about making your legs stronger. It's about building the specific muscles that keep you steady on your feet. It's about protecting your balance and your bones in ways that walking alone simply cannot do. In this video, I'm going to share with you 5 leg exercises that surgeons and physical therapists recommend for people over 75. These aren't complicated gym routines. You don't need special equipment. You don't even need to leave your home. But what these exercises can do for your strength, your balance, and your long-term health is truly remarkable. So if you're ready to learn something that could genuinely improve your life or the life of someone you love, stay with me till the end of this video, because what you're about to discover is information that every person over 75 needs to know. Before we continue, let me know in the comments how old you are and where you're watching from. Also, hit that subscribe button and turn on the notifications so you won't miss out on more helpful content like this. Alright, let's dive in. Let me start by explaining something that might surprise you. When doctors and surgeons talk about healthy aging, they often focus on one thing above everything else. And it's not your heart, it's not your diet, it's not even your memory, it's your legs. Your legs are what keep you independent. They're what allow you to get out of bed in the morning without help. They're what let you go to the bathroom by yourself. They're what make it possible to visit your grandchildren, to go shopping, to live in your own home instead of needing constant care. Dr. Jonathan Phillips, an orthopedic surgeon who has worked with elderly patients for over 30 years, puts it this way. The strength in your legs determines the quality of your final decades. It's that simple and that important. Now, here's what happens as you age. Starting around age 50, we begin to lose muscle. This is a natural process called sarcopenia, but it speeds up significantly after age 75. In fact, research shows that without resistance exercise, people over 75 can lose up to 5% of their muscle mass every single year. 5% might not sound like much, but think about it this way. If you lose 5% each year, in just 5 years, you've lost a quarter of your muscle strength, and most of that loss happens in your legs. This is why people start shuffling when they walk. This is why getting up from a chair becomes harder. This is why climbing stairs feels impossible, and this is why falls become so dangerous. But here's the good news, and this is really important to understand. This muscle loss is not inevitable. You can stop it. You can even reverse it. And the way you do that is through specific leg exercises that target the exact muscles you need for balance, stability, and strength. Walking is wonderful for your cardiovascular system. It gets your blood flowing, it helps with circulation. But walking doesn't build the kind of leg strength you need to prevent falls. It doesn't strengthen the muscles around your knees and hips, and it doesn't improve your balance the way targeted exercises do. That's what's at stake here. That's why these exercises matter so much. Now let's talk about the first exercise, and this one is so simple, you might already be doing a version of it every single day without even realizing it. It's called the sit-to-stand exercise, and it's exactly what it sounds like. You sit down in a chair, and then you stand back up. That's it. But the way you do it makes all the difference in the world. Here's why this exercise is so powerful. Every single time you get out of a chair, you're using the largest muscles in your body. Your quadriceps, those big muscles in the front of your thighs, have to work hard to lift your body weight. Your glutes, the muscles in your backside, have to engage to push you upward. And all the small stabilizing muscles in your hips and core have to fire to keep you balanced. Think about how many times a day you sit down and stand up, getting out of bed, getting off the toilet, getting out of a car, sitting at the dinner table. These are the movements that define independence. And when these movements become difficult, that's when people start needing help with basic daily activities. Dr. Maria Santos, a geriatric physical therapist, says something I think is really important. She says, if you can't get out of a chair without using your hands, you're at high risk for falls and loss of independence. But the beautiful thing is, this is a skill you can rebuild at any age. Now, let me tell you how to do this exercise properly. And please, safety first always. Start by sitting in a sturdy chair. Not a soft couch, but a firm chair with a solid seat. Your feet should be flat on the floor, about hip width apart. Sit toward the front edge of the chair. Here's the key. Cross your arms over your chest. Don't use your hands to push yourself up. If you absolutely need to use your hands at first, that's okay. But the goal is to work toward doing this without hand support. Now, lean forward slightly from your hips. This is important. You want your nose to come forward over your toes. Then, push through your heels and stand up. Take your time, move slowly and with control. Once you're standing, pause for a moment. Feel your balance. Then, slowly lower yourself back down into the chair. Again, move with control. Don't just drop down. That's one repetition. Now, a study from the Journal of Strength and Conditioning Research looked at adults over 75 who did sit-to-stand exercises 3 times a week for 12 weeks. The results were remarkable. On average, participants improved their leg strength by 31%. They were able to walk faster, they reported feeling more confident, and most importantly, their risk of falling decreased significantly. 31% stronger in just 12 weeks. That's the power of this simple exercise. Here's how to start. If you're new to this, begin with just 5 repetitions. Do this twice a day, morning and evening. As you get stronger, and you will get stronger, increase to 10 repetitions. Eventually, you can work up to 15. The beauty of this exercise is that you can do it anywhere. You can do it while watching television. You can do it after meals. You can make it part of your daily routine without it feeling like formal exercise. When you strengthen your legs with this movement, you're making it easier to get dressed, to use the bathroom independently, to get in and out of cars, to visit friends and family. You're protecting your independence in the most practical way possible. The second exercise I want to share with you is called standing knee raises, and this one is absolutely crucial for balance and stability. Let me explain why balance becomes such a critical issue as we age. You see, balance isn't just about not falling over. It's about confidence. When your balance is good, you walk with confidence. You move around your home without fear. You can navigate uneven sidewalks, reach for items on shelves, and turn around without worrying. But when balance starts to decline, everything changes. You become hesitant. You start holding onto walls and furniture. You avoid going places because you're afraid. And that fear itself can lead to less movement, which leads to more weakness, which leads to worse balance. It becomes a downward spiral. The good news is that balance is trainable at any age, and standing knee raises are one of the best ways to improve it. Here's how to do standing knee raises safely and effectively. First, stand next to a sturdy chair or counter, something solid that won't move if you need to hold it. In the beginning, you might need to hold on with both hands. That's perfectly fine. As you get stronger and your balance improves, you can progress to holding on with just one hand, then just fingertips, and eventually not holding on at all. Stand up straight. Imagine a string pulling gently from the top of your head toward the ceiling. Keep your shoulders back, but relaxed. Now, shift your weight onto your left leg. Take a moment to feel stable. Then slowly lift your right knee up toward your chest. You don't need to lift it super high. Even lifting it a few inches off the ground is beneficial. Hold this position for 3 to 5 seconds if you can. Lower your foot back, down slowly. Feel both feet on the ground. Take a breath, then lift the same knee again. Do this 5 times on one leg, then switch to the other leg and do 5 more. Now, here's what's happening when you do this exercise. First, you're strengthening your hip flexors. These are the muscles that lift your leg when you walk. When hip flexors are weak, people start shuffling instead of taking normal steps. Shuffling is one of the main reasons people trip and fall. Second, you're challenging your balance. Standing on one leg, even for a few seconds, forces all those small stabilizing muscles in your ankle, knee, and hip to work. These muscles often get neglected, but they're incredibly important for preventing falls. Third, you're improving what's called proprioception. That's your body's ability to know where it is in space. Good proprioception means your body can make tiny adjustments automatically to keep you upright. It's the difference between catching yourself when you stumble versus falling. As you practice this exercise, you'll notice something wonderful. Each week, you'll feel a little steadier. You might notice that you don't need to hold on as tightly, or that you can hold your knee up for longer. These small improvements add up to something major: freedom of movement. Start with 5 raises on each leg once or twice a day. As you improve, you can increase to 10 raises per leg. You can also make the exercise more challenging by holding your knee up for longer, or by adding a slight knee-to-chest lift at the top of the movement. But remember, this isn't a competition. This is about steady, safe progress. Some days will feel easier than others, and that's completely normal. Now, let's move to the third exercise. This one targets a part of your legs that you might not think much about, but it's absolutely vital for safe walking and fall prevention. I'm talking about your calves. And the exercise is called calf raises. Your calf muscles do something very important. Every time you take a step, your calf muscles push you forward. They're the power behind your stride. They also help you navigate stairs, walk on slopes, and recover your balance if you start to tip forward. But here's what happens with age. Calf muscles tend to weaken faster than you might think. And when they're weak, your walking becomes less stable. You lose the spring in your step, and if you trip, you don't have the strength to catch yourself. A study in the Journal of Biomechanics found that seniors with stronger calf muscles had significantly better balance recovery. When they stumbled, they were able to prevent themselves from falling. Those with weaker calves were more likely to go all the way down. Here's how to do calf raises properly. Stand next to a sturdy counter or the back of a heavy chair. Place your hands lightly on the surface for balance. Your feet should be about hip-width apart, toes pointing forward. Now slowly rise up onto your toes. Lift your heels off the ground as high as you comfortably can. You should feel your calf muscles working. Hold this position for 2 to 3 seconds. Then slowly lower your heels back down. And I really want to emphasize the word slowly here. The lowering part of this exercise is just as important as the lifting part. It builds what's called eccentric strength, which is crucial for controlling your movement. That's 1 repetition. Start with 8 to 10 repetitions. Rest for a moment. Then do a second set of 8 to 10. As you get stronger, you can work up to 15 repetitions per set. Now, what makes this exercise so valuable is that it directly improves your walking ability. When your calves are strong, you can take longer, more confident steps. You're less likely to shuffle, and you have better power to get yourself up if you're walking uphill or climbing stairs. There's another benefit that people don't often talk about. Strong calves help with circulation in your legs. They act like a pump, helping blood flow back up from your feet to your heart. This can reduce swelling, decrease the risk of blood clots, and improve overall leg health. A 12-week study with seniors showed that those who did calf raises regularly improved their walking speed by an average of 15%. Now, that might not sound like a huge number, but think about what it means practically. It means you can cross the street before the light changes. It means you can keep up when walking with friends. It means you feel less rushed and more in control. As you practice calf raises, you might notice that one leg is stronger than the other. This is completely normal. If you want, you can do a few extra repetitions on the weaker side to help even things out. Now, before we continue to the remaining exercises, if you're finding this information helpful, please take a moment to hit that like button. It helps more people discover this information. Subscribe to the channel so you won't miss out when we release more content on healthy aging tips for seniors. Also, please share this video to a friend, colleague, or family member that might need it. Alright, let's continue. The 4th exercise is called standing leg extensions, and this movement targets the muscles around your knee in a way that's gentle but incredibly effective. Let me talk about knees for a moment. Knee problems are one of the most common reasons people lose mobility as they age. Arthritis, general wear and tear, weakness in the surrounding muscles, all of these things can make knees painful and unstable. But here's something important. Strong muscles around your knee actually protect the joint. They take pressure off the cartilage and bones. They provide stability and support. Think of strong leg muscles as a natural knee brace that you build from the inside out. Here's how to do standing leg extensions. Stand behind a sturdy chair and hold onto the back of it with both hands. This exercise requires balance, so having solid support is important. Shift your weight onto your left leg. Make sure you feel stable and balanced. Now, keeping your right knee slightly bent, slowly kick your right leg forward. Not a big kick, just extend your leg out in front of you until it's relatively straight. Your foot should stay about 6 inches off the ground. You should feel the muscles on the top of your thigh working. Hold this position for 2 to 3 seconds. Then slowly bring your leg back to the starting position. Do this 8 to 10 times, then switch to your other leg. What makes this exercise so beneficial is that it strengthens your quadriceps, those big muscles on the front of your thigh, in a very controlled way. Unlike squats or lunges, which can be hard on the knees, leg extensions are gentle. You're not putting your full body weight through the joint. This is especially important for people who already have some knee discomfort. You're building strength without aggravating existing problems. A study from the American Journal of Physical Medicine followed seniors with mild to moderate knee arthritis. Those who did quadriceps strengthening exercises like leg extensions for 3 months reported 37% less knee pain and 42% better physical function. Think about what that means. Less pain, better ability to walk, to climb stairs, to do the things you want to do, and all from a simple exercise that takes just a few minutes a day. There's another benefit I want to mention. Strong quadriceps help you walk more efficiently. They help you go up and down stairs with less effort. and they're crucial for preventing knee injuries if you do stumble or step awkwardly. When you first start this exercise, you might find that your leg feels heavy or shaky. That's completely normal. It's a sign that these muscles need strengthening. Be patient with yourself. Start with just 5 repetitions if that's all you can manage. The important thing is consistency, not perfection. As you practice over the weeks, you'll notice that your leg feels lighter, the movement becomes smoother, and daily activities that involve your knees, like getting in and out of cars or kneeling down to pick something up, all become easier. One 76-year-old man I read about in a case study had given up gardening because he couldn't kneel without severe pain. After 3 months of leg exercises, including leg extensions, he was back on his knees planting tomatoes. He said it felt like getting a piece of himself back. That's the power of these exercises. They're not just about muscles and joints. They're about maintaining the activities that give your life meaning and joy. Now we come to the 5th and final exercise. This one is called side leg raises, and it targets a part of your body that's absolutely critical for preventing falls but often gets completely ignored. I'm talking about your hip abductors. These are the muscles on the outer part of your hips and thighs, and they do something vitally important. They keep you from tipping sideways. Think about it this way. When you walk, you're actually balancing on one leg with each step. For that split second, when one foot is in the air, the muscles on the side of your standing hip have to work hard to keep your pelvis level and your body upright. When these muscles are weak, you get what's called a Trendelenburg gait. That means you wobble side to side when you walk. It looks a bit like a waddle, and this wobbling makes you unstable. It makes falls more likely, especially sideways falls, which are particularly dangerous for your hips. Here's a sobering fact. Falls that lead to hip fractures are one of the most serious health events for seniors. According to the National Institutes of Health, about 20% of seniors who break a hip die within 1 year of the injury. Many others never regain their previous level of independence. But strong hip abductors can significantly reduce your risk of the kinds of falls that lead to hip fractures. A study in the Clinical Journal of Sport Medicine found that seniors who did hip strengthening exercises reduced their risk of hip fractures by up to 40%. 40%, that's potentially life-saving. Here's how to do side leg raises safely. Stand next to a counter or heavy table. Hold on with one hand for balance. Let's say you're holding on with your right hand, so the counter is on your right side. Stand up straight. Engage your core gently. Not a hard flexing, just a gentle tightening of your belly. Now, slowly lift your left leg out to the side. Keep your toes pointing forward, not turning up toward the ceiling. Lift your leg about 6 to 12 inches off the ground. You don't need to lift it high. In fact, going too high can cause you to lean, which reduces the effectiveness of the exercise. Hold for 2 seconds, then slowly lower your leg back down. That's 1 repetition. Do 8 to 10 repetitions on this side. Then turn around so the counter is on your left and do 8 to 10 raises with your right leg. What you should feel is the muscles on the outer part of your hip and thigh working. If you're feeling it in your lower back, you're lifting too high or leaning too much. Keep the movement small and controlled. What I love about this exercise is how quickly you can feel improvement. Within just 2 weeks of regular practice, most people notice that they feel more stable when they walk. That side-to-side wobble starts to decrease. Confidence grows. As you practice this exercise, pay attention to any differences between your 2 sides. Most people have one side that's a bit weaker. If you notice this, you can do an extra set on the weaker side to help balance things out. Also, remember that quality is more important than quantity. It's better to do 5 really good, controlled repetitions than 15 sloppy ones. Focus on feeling the right muscles working. Focus on keeping your body upright and stable. Over time, you can progress this exercise by holding your leg up for longer, maybe 5 seconds instead of 2. Or you can add a resistance band around your ankles for extra challenge, though that's completely optional. So, there you have it. 5 powerful leg exercises that surgeons and physical therapists recommend for people over 75. Each one of them targets something specific and important. But together, they create a complete program for leg strength, balance, and stability. Now, I want to emphasize something crucial. These exercises are not a replacement for medical care. If you have any health concerns, if you've had a recent surgery, if you have severe arthritis or balance disorders, please talk to your doctor before starting any new exercise program. But for most people over 75, these exercises are not only safe, they're essential. And here's the beautiful part. You don't need to spend hours at the gym. You don't need expensive equipment. You don't need to leave your home. You can do all 5 of these exercises in about 15 to 20 minutes. Imagine this. What if you did these exercises 3 times a week? Just 3 times. Maybe Monday, Wednesday, and Friday. Or Tuesday, Thursday, and Saturday. Whatever fits your schedule. In 1 month, you'd notice differences. Your legs would feel stronger. Getting up from your chair would be easier. You'd feel more stable on your feet. In 3 months, the changes would be significant. You'd walk with more confidence. You'd have better balance. Activities that had become difficult would become manageable again. In 6 months, you could be in the best shape you've been in years. And I'm not exaggerating. The research consistently shows that seniors can make remarkable improvements in strength and function with consistent exercise. Now, I want to address something. You might be thinking, this sounds good, but I'm not sure I can do this. Or I'm too weak to start. Or what if I hurt myself? These are valid concerns, and I want to reassure you. First, start slowly. If you can only do 3 repetitions of each exercise, that's fine. Do 3. Next week, maybe you'll be able to do 4. The point is progress, not perfection. Second, it's okay to modify. If you can't do sit-to-stands without using your hands, use your hands. Work toward the goal of not using them, but don't let that stop you from starting. Third, listen to your body. These exercises should never cause sharp pain. You might feel your muscles working. You might feel some muscle fatigue afterward. That's normal. But if something hurts in a bad way, stop. Check your form. Maybe start with fewer repetitions. And fourth, be consistent. The key to seeing results is doing these exercises regularly. 3 times a week is ideal, but even twice a week will help. The worst thing you can do is nothing. If you're watching this video because you care about an older parent or grandparent, thank you. Thank you for taking the time to learn this information. Thank you for wanting to help someone you love stay healthy and independent. Share this video with them. Better yet, watch it together. Maybe you could even do these exercises together a few times a week. It could become a special time you share, and you'd be giving them a gift that's more valuable than almost anything else, the gift of strength and independence. Remember, walking is wonderful. Please keep walking if you enjoy it and if it's part of your routine. But walking alone is not enough to prevent falls, to maintain leg strength, and to protect your independence as you age. You need targeted exercises that build the specific types of strength and balance that matter most. And that's exactly what these 5-leg exercises do. If you found this information valuable, I would be so grateful if you would hit that like button right now. It takes 1 second, and it helps this video reach more people who need this information. Subscribe to this channel so you'll stay updated when we release new videos on healthy aging, longevity, and maintaining your independence. Also, share your thoughts in the comments. Let me know which of the exercises you're going to try first. I read and reply every comment. I want to hear about your progress. Thank you so much for watching, and I'll see you in the next video.